In 2015, the First Lady of Uganda, Mama Janet Museveni, hosted and launched the 11th and final elimination of mother-to-child transmission of HIV/AIDS campaign. Since then, the HIV/AIDS infection among the children reduced in the country. Today, while officially opening a 3-day international pediatric HIV/AIDS symposium for Africa 2024 in Kampala, Health Minister Hon Dr. Ruth Acheng has revealed that despite the government efforts to reduce on the cases of mother-to-child HIV/AIDS transmission, there are still some existing cases of children being born and living with HIV.
There are many people that cannot afford formula feeds, and that is why we insist on testing immediately at birth and ensuring that the mothers and the babies are on treatment, because we all know that when you're virally suppressed, you're unlikely to transmit, so that they are free to breastfeed their mothers for the recommended period of time. But of course, we have cases that escape these initiatives or interventions, and they are not on treatment, and their babies are not on treatment, but they still breastfeed, and we end up with HIV infection. So in that area as well, interventions are ongoing, especially through education.
Honorable Acheng, however, notes that mother-to-child transmission of HIV/AIDS has reduced ever since the Mama Janet Museveni launched the campaign to reduce the virus.
Well, in regards to prevention to mother-to-child transmission, many of you will recall that the First Lady of Uganda took it upon herself to run a campaign to ensure that we reduce mother-to-child transmission. At that time, we had 25 new infections every year. The First Lady moved to every part of Uganda, every district in Uganda, talking to the mothers, talking to the parents, talking to the communities, emphasizing the need to reduce mother-to-child transmission and supporting the program with all the interventions that are necessary, and also advocating for having testing done in the facilities. So what we are seeing now is an effort of the First Lady that has come to fruition. She has not stopped. She is still continuing with the program.
Dr. Eleno Namsoke Magongo, the founder of International Pediatric HIV/AIDS Symposium for Africa, mentioned that only 50% of children living with HIV/AIDS in Uganda are on treatment, an indicator that the country is lagging behind in terms of identifying children with HIV/AIDS.
The statement that children are lagging behind is because when we look at those 3 indicators for adults, we are almost reaching our targets of 95% of people who are living with HIV being identified, and 95% of people living with HIV on treatment, and 95% of them are doing well on their medication because they are virally suppressed. When we look at the statistics for children, for example, for treatment, globally, and also what we see in most of our countries as well as Uganda, we only have slightly above 50% of children who are living with HIV globally who are on treatment. And in Uganda, we are about the same picture. So that's why I mentioned that the HIV cascade for children who are living with HIV lags that of the adults. So the same thing for all the other indicators.
Dr. Namsoke explains that though many children living with HIV/AIDS have not been identified, the ministry is putting strong efforts to identify these children through the Munonya HIV testing campaign.
For children, we are really lagging behind. For example, in viral load suppression, we are just at about 43% if you use the denominator of people living with HIV. So we need to ensure that we are intensifying our efforts in terms of identifying children who are living with HIV, starting them on optimal treatment, and ensuring that they are supported to remain on treatment so that they can be virally suppressed. And the reason we started this meeting was to precisely address that gap by bringing together pediatric HIV stakeholders from all over the African continent and beyond.
Julius Muhumuza, Church of Uganda Family TV, News at 8.